Hi, I'm Dr. Barry Gillespie, and I practice in the King of Prussia Medical Center in King of Prussia, Pennsylvania, the United States of America. And today I'm going to discuss pediatric asthma. The asthma work started in the summer of 1980, and what happened was I was in my practice on Cape Cod, and I was a periodontist at the time, and I did TMJ, and I saw people and children with headaches. And I was seeing this boy, Jimmy, who had a headache, and it was around the fifth visit, and his mother came in. I said, "How's Jimmy doing?" He said, "He's doing great." He said, "Not only are his headaches gone, but his sinuses are opening up, his earaches are gone, and his asthma's gone." Well, I could see in my TMJ work that how the sinuses could be opened up and how the earaches could be gone because of the TMJ, the jaw and the face. But asthma, I couldn't see that, and we really didn't study asthma too much in school. We kind of bypassed that, and to be honest, I really blew it off, just saying that, well, nothing really happened there and just got lucky and something like that. But what I did was, in the next group of children that were coming in, not only would I ask them if they had headaches, I would ask them if they had earaches or asthma or sinus problems or allergies or ADHD, and I went through a lot of different conditions. So what I found in the next year or so was the next 4 children with asthma that came in, after therapy was done, the asthma was gone. So from being a fluke with just 1, and now we're at 5, and I said to myself, there's something going on here. I have no idea what it is, but I'm going to study it and I'm going to find out, and we're going to get to the bottom of what's really happening here. And I spent the 80s and 90s doing research, trying to find what the problem was. In the clinical research, I was looking at children specifically for asthma. And when I was doing that, the earaches got better, the ADHD kind of went away, and a lot of great things were happening, but I was pretty much focused on asthma. And at that time, of course, there was no internet. So I had to go into the medical libraries, use the hospital libraries. I went up to Boston, I read books, I got all the journals, the asthma journals. I was trying to educate myself about the anatomy and the histology and the physiology of the respiratory system. And I was trying to connect that to what was happening clinically. And basically the fascia of the system, which we'll talk about a little bit later, was starting to release and open up. And as the body started to open up, the body could heal, and the child could breathe better. So it was the kind of situation where if you came for a visit, the asthma just didn't go away like that. It went away over a series of visits as the respiratory tissues were loosened. The child could breathe better, and the parents, the doctors usually tailed off the medication, and most of the children didn't need medication after that. So the bottom line is that we found out that I believe that asthma is a disease of tightness. The respiratory system is tight. And if we can help loosen that system, loosen the respiratory system, most children respond pretty well. Healing Your Child was a book that was, it was thought about by my son. We were watching the Olympics in Atlanta in 1996, and a swimmer came on, and the swimmer had asthma. And my son turned to me and said, "Well, why did the swimmer go to you?" I said, "Well, they don't know about it." He said, "Well, why don't you write a book? You got to write a book about it." So I spent 3 years writing Heal Your Child, and we talk about asthma, earaches, and headaches, and all the conditions that we got into in childhood. And we feel, bottom line is that there are structural issues where the children are tight and they're twisted, and once we start to loosen them up, there are a lot of conditions that can get better. And we also found that it may be involved with cognitive issues, like being able to focus, being able to concentrate, being able to think well, being well to do in school, to do your math. Everything had to be loose, everything had to be free around the brain. About 20 years ago, I felt there was a craniosacral fascial system, and I'll describe that system a little bit. The craniosacral aspect is where the brain has to slowly expand and slowly contract. And it's this expansion and contraction over a period of seconds we call the brain is breathing. At the same time, the sacrum is the tailbone, and that's gently flexing and gently extending in sync with the brain motion. And usually with children who are having difficulty, there's a lot of tightness around their head. And if this is their brain, there's really little or none expansion and contraction. And as we start to treat after the first visit, the brain will slowly start to expand and slowly start to contract. After second and third visits, the brain will just open up a little bit more. And eventually when we're done, the brain will fully expand, hopefully to 100 seconds, and it'll fully contract to hopefully 100 seconds, where this total brain cycle, the expansion and contraction, is around 200 seconds. Also, the connective tissue, or the fascia is the connective tissue that surrounds every muscle cell. It goes into every organ, it goes into every bone, it goes around the blood vessels, it goes around the nerves, it goes up into the eyes, it goes into the teeth, it goes from head to toe, finger to finger. It allows to be upright, it allows us tensegrity, it allows us to, that our organs can sit up, that they're all not flopping down. It allows us to stand up, that we're not like jello. We have this fascial web that just holds us in place against gravity. Unfortunately, if this web gets tight, it may cause problems around a specific area. In asthma, we believe that the respiratory system can get tight. And the respiratory system is a system that I'm referring to, the nasal area, the nasal pharynx, down into the throat, down around the larynx, down into the trachea, down to the tracheobronchial tree, down into the left and right lungs, and also in the diaphragm. This is classically the respiratory system. And in the children with asthma, there's tightness. And there might be tightness in one particular area, multiple areas, or the whole thing may be tight, where the child has difficulty breathing, where they can't take a breath. And asthma is not a bacterial infection, it's not a viral infection, nobody really knows. But what I believe, what I've seen over 35 years, it strongly is indicated as a disease of tightness. This fascial system, this craniosacral fascial system gets tight. And once we start to help the body free it up, the child can start to breathe better, they need less medication, and their doctor says there's improvements. And over a series of visits, the goal is to restore normal health and just restore normal breathing, so the child doesn't have asthma anymore and the child doesn't need medication. That is the ultimate goal. The newborn work is very exciting, and I remember I was working on a newborn maybe around 2009. An associate of mine were invited into a hospital at birth, and we wanted to be there right when the baby was born. But as soon as the baby was born, the baby had a breathing problem, the baby had a lung problem, and the baby was taken to the NICU. So we waited 2 days, got a call from the parents, and we're out of the NICU, and she and I are working on the baby, and I'm holding the baby, and I'm holding the lungs, and I've got my eyes closed, and I'm feeling this 2-day-old baby, and I said, I'm thinking to myself, if I didn't know any better, this is the same strain that I see in 9-year-old kids who have asthma. It's the same pattern here. And we worked with this infant for a number of visits, and we felt that it had cleared. So we feel that there may be a strong correlation between birth trauma that happens in utero, during labor, during delivery, and the health of the child, whether that child has chronic headaches, whether that child has asthma, whether that child has earaches, whether that child has cognitive issues. We feel that many children that we see, the root of their problem, the problem started at birth and through birth trauma, and no one really noticed, and the child grew up with earaches, allergy problems, and start to get breathing problems and bronchitis, and then they have asthma, and it's just a progression of being tight. So it's interesting how we started with the young children with asthma, 8, 9, 10 years old, and we feel that it's a very strong possibility it can be prevented at birth if birth trauma is causing that tightness in the respiratory system. When I first started working with asthma children in 1980, I mean, it was rare that anybody under 4 was diagnosed with asthma. And now in 2015, 35 years later, we have children that come in and they're diagnosed with asthma and they're 6 months old or they're 4 months old. Our doctor said they have asthma. And so we can trace it all. We feel we can trace it all the way back to possible birth trauma. Okay, in summary, with asthma, we feel that it's a disease of tightness. If there's a lot of pressure, a lot of tightness in the respiratory system, whether it be in the nose, the nasopharynx, through the throat, larynx, tracheobronchial tube, lungs, diaphragm, any tightness in this area can cause a strain in there. That system can't function that well. And when the pressure is slowly relieved over a number of visits and the asthma starts to clear out, it's a pretty strong indication that it sure looks like it's a disease of tightness. So we're excited about the future. We're interested in basic science research. We'd love to have hospital studies. We'd love to have people come along and say, yeah, you're right, it is tightness. We had clinical studies. We looked at it in the laboratory. We need some collaboration. So I'm very excited about the future. Thank you.